Diastasis recti is a condition that affects the six-pack muscle, the rectus abdominis. And the important thing to know about the rectus abdominis is that it isn't just one muscle. There's a left side of the muscle and the right side of the muscle that is held together by a connective tissue called the linea alba, right down the middle. Diastasis recti is when that connective tissue that holds the left and the right side of the muscles together gets really stretched so that the muscles kind of start separating and stretching away from each other. So women who've had multiple pregnancies or pregnancies really close to each other have a higher chance of having the stretching of the muscle and the connective tissue. So diastasis recti is really just an overstretching of connective tissue that causes some weakness in the core muscles around your stomach. So what does that really mean? What does that look like? Well, it can cause pain, discomfort, and also difficulty performing like typical activities such as bending down, lifting your child, carrying your child, pushing and pulling different objects. Anything that causes some tension or stress to develop around your core can be uncomfortable or even hard to do because of diastasis recti. You can even have a little bit of back pain, you can have hip or pelvic pain as a cause of diastasis recti. The good news is that diastasis recti can be diagnosed and treated pretty easily with physical therapy and some gentle strengthening exercises of your abdominal muscles. However, the more important thing is that if you perform an exercise and core strengthening routine during your pregnancy or before your pregnancy, that actually reduces the risk or likelihood of developing diastasis recti in the first place. So let's talk about how we diagnose diastasis recti. To diagnose diastasis recti, you're measuring how many finger widths are there of space in between the left and right side of your stomach muscles, your rectus abdominis. So basically, you're taking your fingers and kind of pushing them in towards your belly button and seeing how many finger widths of space is there between the left and right side. And then you're going a little bit below, so around 2 inches below, 1 to 2 inches below, and kind of pressing in again and seeing how much space there is. And then going a couple inches above the belly button and seeing how many finger widths of spaces are in between. If the space is increasing at a certain point or is greater than like 2 finger widths apart, then that's an indication of diastasis recti. And also, if you can kind of spread the muscles apart while you're generating tension, if you're tightening your stomach and you can still pull the muscles apart, that also means you have diastasis recti. So this is what it looks like if you're testing yourself. So you're gonna lay down with your knees bent, your back pretty relaxed on the floor, and take your hand and kind of push right by your belly button. Push a little bit below your belly button, and then push a little bit above your belly button. And then you want to tighten your stomach so you can either push against the floor or you can lift your head up and retest the same thing. So if you feel like the space is increasing when you're generating stress in your abdominal muscles, that's an indicator that you have diastasis recti. So now that we've diagnosed that diastasis recti is definitely there, there are a lot of exercises that you can do to improve your symptoms. However, the main thing is to not just go ahead and do any kind of core exercises, because if you try to do really advanced core exercises too early, that can actually cause a separation to occur a little bit more. So it's very important to kind of scale it back, start with the fundamentals, and really slowly, progressively increasing the intensity of core exercises you do. So this is like my typical progression with diastasis recti. The first exercise is a pelvic tilt. So you're going to get on your floor with your knees bent, and basically you're going to use your stomach muscles and your pelvis to flatten your lower back. Hold it for like 5 seconds and then relax. So flatten, hold, and relax. Flatten, hold. So right now the space between the lower back is not there. And now there's space between my lower back. So I'm going to flatten and relax. So you can also do that same exercise in a quadruped position. So from here, you want to flatten and then arch. Flatten and arch. Flatten, arch. Flatten. And all of that motion is coming from right here in the pelvis. So next we're going to combine the pelvic tilt and add in leg movements. So start in the pelvic tilt and maintain your back being flat against the floor. And then you're gonna lift one leg and then down. Lift one leg, down. And maintain that flatness in your back. The important thing is to keep breathing this whole time. A more advanced version of that previous exercise is doing it with your legs lifted in the air. So same position, keep your back flat, lift both of your legs, and then tap, tap, tap. And you want to maintain your back being flat the whole time. That's the important part of this exercise. Another exercise I like to do is a variation of the bridge to get the inner part of my thighs working as my glutes are lifting my back up. So same position, get a pillow, put it between your thighs, squeeze the pillow and bridge up and relax. Squeeze, bridge, and relax. Squeeze, bridge, relax. Squeeze, bridge,